Hello and welcome back to Afroturk TV. I'm Professor Başak Çetiner Baksu, Professor of Obstetrics and Gynecology from Istanbul, Turkey. Today we enter the final stage of pregnancy, the third trimester, between weeks 28 to 40. This is a time of anticipation, excitement, and sometimes discomfort. During this time, the baby grows rapidly and the mother's body prepares for labor. Let's walk through what to expect, how the baby develops, and how mothers can prepare for birth. Why the third trimester is important? The third trimester begins at weeks 28 and continues till birth. The third trimester is a period of rapid growth and maturation. The baby is growing rapidly. Many of the baby's organs have already formed earlier. Now they continue to develop and prepare for life outside the womb. The lungs mature. The brain continues developing. The baby gains weight and strength. These weeks are essential for a healthy start after birth. As for the mother, her body is preparing for labor and emotions often intensify. It is the home stretch, but also a period that requires careful monitoring. Let's look at how the baby develops. During these weeks, the baby undergoes remarkable changes. At around 28 weeks, the baby's eyes can open and close. By week 30, the brain is developing rapidly. By 32 weeks, the baby's movements become stronger. The baby practices breathing movements and begins to develop regular sleep and activity patterns. By 36 to 37 weeks, most babies move into a head-down position, preparing for birth. By week 40, the baby is fully developed and ready for birth. Every week brings new growth and new milestones. Now it is time to go over the changes in the mother's body. As the baby grows, the mother's body also changes. What does the mother experience? Increased belly size and weight gain, back pain and pelvic pressure, Braxton Hicks contractions, the practice contractions, shortness of breath as the uterus expands, swelling in the legs and feet, varicose veins, fatigue, difficulty sleeping, heartburn, frequent urination. These changes occur because the uterus is growing much larger and places pressure on the surrounding organs. These symptoms are common, but they can be very challenging. Remember, your body is working hard to support a new life, but if anything feels unusual or severe, always consult your doctor. How should the mothers monitor the baby's movements? During the third trimester, monitoring the baby's movements becomes very important. Most mothers notice daily patterns of movement. Of course, every baby is unique, but by now, the mother is well aware of how her baby behaves. Doctors often recommend counting fetal movements. If movements suddenly decrease or stop, medical evaluation is necessary. Fetal movement is one of the most reassuring signs of a baby's well-being. What are the warning signs in the third trimester? Seek medical help immediately if you notice vaginal bleeding, severe headache or vision changes, sudden swelling of the face or the hands, severe abdominal pain, decreased baby movements, fluid leakage from the vagina. These may signal complications such as preeclampsia or preterm labor, please be careful. How are the prenatal visits in the third trimester? During the third trimester, prenatal visits become more frequent. Your doctor will monitor blood pressure, your weight gain, check the baby's growth and position, try to listen to the fetal heart rate, evaluate the amniotic fluid level, screen for infections. These visits help detect conditions such as high blood pressure, gestational diabetes, or growth problems. Your doctor will also discuss birth plans. These visits ensure both the mother and the baby remains healthy as delivery approaches. What are the important tests in the third trimester? Some important tests may be performed during this week. One example is glucose screening test, usually done around 24 to 28 weeks, to check for gestational diabetes. Another test often performed between 35 and 37 weeks is screening for Group B Streptococcus, which is a bacteria that may affect newborns. These tests help doctors protect both the mother and her baby. Now here is what you should know about nutrition and lifestyle. Nutrition remains essential. Continue taking iron and folic acid supplements. Eat a balanced meal, rich in protein and fiber. Stay hydrated. And here are some lifestyle tips for you. Gentle exercise like walking or stretching. Rest whenever possible. Avoid heavy lifting. Sleep on your left side to improve blood flow to the uterus. Small habits make a big difference in comfort and health. How do you prepare for birth? The third trimester is also a time to begin preparing for childbirth. Discuss your birth plan with your doctor. Parents may learn about signs of labor, which are regular contractions, water breaking, or bloody show. They learn about breathing techniques, pain management options, hospital preparation like packing your hospital bag, and arrange support after delivery. Please get education about breastfeeding and learn how to prepare for breastfeeding. Learn methods to reduce anxiety and build confidence. What are the signs that shows labor may be approaching? As the due date approaches, several signs may appear. These include regular contractions, lower abdominal pressure, back pain, a loss of mucus plaque, a rupture of the membranes leading to leakage of water from the vagina. When contractions become regular and stronger, it is time to check with a healthcare provider. What are the warning signs in the third trimester? Certain symptoms require immediate medical attention. These include severe headache, vision problems, heavy bleeding, severe abdominal pain, a sudden swelling of the face and head, decreased fetal movements. These may indicate serious conditions like preeclampsia or placental problems. Prompt medical care is essential. Maybe the most important preparation for birth is emotional preparation. Emotionally, the third trimester can be really intense. Excitement mixes with fear of the unknown. Some women feel impatient, others feel anxious. All of these emotions are normal. Lean on your partner, family, and healthcare team for support. This will help you feel prepared and confident. And my final message to you. The third trimester is the final chapter before meeting your baby. It is a time of preparation, strength, and anticipation. Taking care of your health, attending regular checkups, and recognizing the warning signs help ensure a safe birth. To every woman watching, trust your body, trust your instincts, and trust your medical team. You are approaching one of life's most powerful moments. Together, through awareness and education, we can support and empower women everywhere. And remember, healthy mothers create healthy families, healthy societies, and a healthy future. Thank you for listening and hope to see you in the next episode.